Don't even think about it.
You call that a knife?
Gato a casa mais. Zahim! He's getting away!
Welcome, Dr. Bennett.
Hi, Detective Bruce.
As you're aware, we have the PCL Bandit in custody. Before we bring him in for questioning, I'd like to ask you a few questions about the posterior cruciate ligament and the knee joint.
What would you like to know?
Initially, I'd just like you to go over the anatomy of the knee for me, if that's possible.
Okay. Well, the knee is what's known as a hinge joint, and it's made up of the tibia, also known as the shin bone, and the femur, which is also known as thigh bone, and we've also got a patella that is not shown in this picture. Together, the tibia and the femur make up the tibiofemoral joint, and we've also got the patellofemoral joint.
And how are these joints stabilised, Doctor?
Well, the congruency between the femur and the tibia are low, so we have what's known as menisci between these two bones to increase the congruency. We also have ligaments that help stabilise. We've got the medial and lateral collateral ligaments, and we've got the anterior cruciate ligament, which runs from the medial aspect of the lateral condyle of the femur to the anterior aspect of the tibial plateau.
That's not the ligament we are concerned with today, is it, Doctor?
Well, no, today we're worried about the posterior cruciate ligament, which is what we think has been injured on Jackie Zen, and it runs from the anterior aspect of the medial femoral condyle to the posterior aspect of the tibial plateau, and it prevents posterior displacement of the tibia on the femur or anterior displacement of the femur on the tibia.
Thank you, Doctor. I'll go get the suspect now and we'll see if we can get this son of a bitch to talk. The jig is up, Mr. Baronato. Or should I say the PCL Bandit?
I don't know what you're talking about.
Dr. Bennett, tell us exactly what happened to Jackie Zen.
Well, based on the evidence given by the victim, it appears that the tibia has been posteriorly translated on the femur, causing the PCL to rupture.
Impossible. Recent studies have shown that these are commonly injured in males playing contact sports, age 18 to 44, like Adam Goods in AFL, or in people in car accidents when their knees hit the dashboard.
We know it's rare. That's why you've gotten away with it for so long. Are you aware of the pain you've caused your victims?
What pain? What do you mean?
We've got some past cases that we've linked with you. Johnny Hurton has had severe swelling and pain in his knee and can no longer kick the football with his son. Jenny Sawney has had lost mobility and has resulted in her losing her job at the Spearmint Rhino. And finally, Pat C. Lachlan is suffering pain and therefore can no longer use the force plate in his biomechanics tutorials.
Not only that, there can be long-term effects caused by a severe PCL rupture, such as
No.
post-traumatic knee osteoarthritis leading to chronic pain and loss of mobility in the joint, which will obviously decrease quality of life.
No, long-term effects? I didn't know there'd be long-term effects. What have I done?
Time to go to your cell, you scumbag.
Congratulations, Bruce. Looks like he bought him to his knees. Jackie Zen.
Doctor, give me the news. I've got an MRI to show you.
Unfortunately, those don't look good. You've definitely got a tear of your posterior cruciate ligament. Can you have a lie down on the bed and I'll test it with the posterior gliding test?
Okay.
you've got a grade 3 tear of your PCL.
Is that bad?
Well, a grade 1 tear involves a small number of fibres being torn, resulting in pain, but allowing full function. A grade 2 tear involves a significant number of fibres tearing with a moderate loss of function of the knee. A grade 3 tear, which is what you've got, involves a full tear of all fibres, resulting in knee instability and a major loss of function.
What about my career as a rice picker? And what about my badminton?
Well, sadly, I think your career as a rice picker is in jeopardy, and you may not be able to play badminton at a high level again. And I'd recommend that you take the power slide out of your karaoke routine.
I hate that PCL Bandit that I read to a shit. What rehab options do I have, doctor?
So we've got two main options. The first option is conservative and involves no surgery. What we'll do is we'll focus on strengthening the legs, the muscles around the knee, so the hamstrings, focusing on the quads to prevent posterior glide of the tibia on the femur. What we'll also look at is proprioceptive work to increase the stability. You'll have normal function after this treatment option. Alternatively, we can send you in for surgery. That'll involve taking an autograft from your hamstring tendons, and what they do is they drill the hole through your femur and your tibia. They thread the tendon through and to replace the PCL. Eventually, this tendon will change its properties to become more ligamentous and act in replacement of the PCL. This is an effective way of treatment, but is shown to be no more effective than a non-surgical option.
Okay, I'll consider all options. Thank you, doctor.
PCL Bandit. What you say? That you only meant well, cause you did. What you say? That it's all for the best, cause it is. What you say? That it's just what we need. You decided this. What you say? What did she say?
Bye. Have a beautiful time.